Hello, everyone, and welcome to today's Health and Human Service meeting. And welcome again to the live stream, broadcast stream of today's Health and Human Service Committee meeting at 6 p.m. on HPA-TV, Comcast, and Frontier Government Channels 96 and 6032. It'll also be streamed via HPA-TV.org, the HPA-TV Facebook page, and HPA-TV's Roku TV, Apple TV, and Amazon TV apps. It'll also be rebroadcast and made available on the HPA-TV YouTube channel. And thank you for everyone joining today. So I'm having computer issues, so I'm logging in from my phone. So just going from my participants here, we have Corporation Counsel Damar Osborne. Thank you for being here. We have Councilman Gale, who is a voting member. And in lieu of Director Liani Arroyo, who was unable to be with us today, we have Ms. Carmen Chaparro. So with that being said, the first resolution, let me read it for the public. Sorry here, just juggling. So the first resolution is on the agenda is Mayor Brony with the accompanying resolution authorizing the city to accept approximately $525,000 in grant funding from the Fenway Institute. And so I believe, Ms. Shapiro, that you are here to speak on that. So the floor is yours.
Yes, thank you. So this $525,000 grant comes to us in the form of $190,000 per year. It is the funding is given to communities where that have Ryan White Part A funding already. And the intent of this funding really is to work closely with two of our clinics. So there were different areas that they could get funded for. And so they are, we've been funded for the Max Clinic strategy, which allows us to do work around individuals suffering from substance use disorder and in HIV. So the strategies for that will include working with Charter Oak Health Center and Hartford Hospital. And the intent is to intentionally link individuals living with HIV and AIDS and who may be experiencing substance abuse disorders to get more better wraparound services. So their access to these particular health centers, the funding will help us pay for one staff member at each site that will allow them to link individuals that come in to immediate services. So they're leaving with necessary medications. They're not having to wait for follow-up appointments, et cetera. So this is really intended to help reduce some of the substance use amongst our population, which we have seen sort of fluctuate up and down over the course of the last 3 to 4 years. And that we know once, if an individual is suffering from this disorder, their ability to, maintain their HIV meds and, manage that piece of their lives becomes a little bit more difficult. So this grant is really intended to help kind of partner with our Ryan White Part A program and help individuals really get better and really well-needed wraparound services. Are there any questions?
Yes, I'll open the floor to any of my colleagues who have questions. Councilman Miguel.
Sure, thank you, Mr. Chair. And thank you for that. Do I understand that this is an ongoing grant? And I guess I'm including in that question, I'm asking, have we received this in the past? So we're just continuing the services that we've been providing. And when you talk about staffing, at Hartford Hospital and Charter Oak, we're just continuing that staffing. Is that the idea?
So this is a new grant to us. So we have the Ryan White Part A grant, and then we have the Ryan White Part B grant, and now we have this third grant, which is intended to be a partner to Ryan White Part A. So the partners that will be working, so Charter Oak and Hartford Hospital are already existing partners to us on the Part A grant. And so this particular grant is, this new grant is intended to really just enhance some of those services and allow us to do it a little bit better.
And so it will allow us to hire 2 more people, I take it.
Yeah, the staff will be hired through the 2 community agencies.
And is this grant then going to cover multi-years?
Yes. So the terms of this grant are from July 2022 through June 2025, I think, 2024. 2025 or March 2020. So July 1st, 2022 through March 31st, 2025.
2025. So not quite 3 years, a little bit shy of 3 years.
Yeah.
All right. Thanks very much. That's all I have, Mr. Chair.
Sure.
Thank you, Councilman Gale. So I have a couple questions. Can you hear me okay, Ms. Chaparro? Mrs. Chaparro?
I can, thank you.
Thank you. In our partnership, can you explain a little bit more the partnership with the Fenway Institute? It says this is a new grant. Is this our first time partnering with them? How does that relationship work?
So the Fenway Institute, I don't know, regretfully, I don't know a whole lot about them, but they do a lot of work with HRSA, who funds our Ryan White Part A. HRSA also funds the state for the Ryan White Part B, which we then get as a pass-through. But this particular organization, works with HIV programs throughout the country. And one of the stipulations of this particular funding was that the community needed to be a Part A funded community. So, or the agency had to be a Part A funded agency, and we had to show proof of that. So I don't know if that answers your question, Councilman.
Well, I guess, are they a fiduciary? Are they providing the training for the staff? Why we couldn't get the money directly, I guess, from the city side?
Well, we are receiving the money directly from them.
Okay. So the money's coming from the Fenway Institute?
The money's coming from the Fenway Institute to us, and then we're subbing some of that. We're keeping a very small part of it for the senior project manager,
right,
and the fiscal person, and then we're subbing it out.
Got it. I understand that now. So the second question I have is in terms of the staffing at each site. Do we have a general idea of what the salary is going to be?
In the budget right now, the salary is at $37,440, so $18 an hour for the data entry coordinators. So there is a large evaluation component to this grant. So the budget will include, these one position each, one at Hartford Hospital, one at Charter Oak.
So the data entry coordinators aren't the one that's doing the work though, right?
They'll be the ones coordinating, all of the data collection. And then, so remember I said that these 2 partners are already part of our Ryan White Part A group. Right. So they already have staff built in, right, to do some of this work.
Wonderful. Thank you so much. So it's like a support services for the data end. That's great. The last question I have, wraparound. I know it's a common term, but there are different types of, evidence-based wraparound and various models across the country. What type of evidence-based, is it an evidence-based model, or is this what kind of wraparound services are we providing?
I apologize because I don't know the answer.
Okay, it's all right.
Whether it is an evidence-based approach or not. Certainly we've seen some of our approaches that are evidence-based, but I presume that, and I can get an answer for you for sure, but I presume that the fact that there's so much data collection on this, that if they're not already evidence-based, they are hopefully going for that status, because of the focus on the data collection and evaluation.
Wonderful. That makes a lot of sense. So thank you for that. And you could just email the folks on the committee, if it is an evidence-based or what type of approach you're using. So that's all I had for questions. I'll entertain a motion.
Move that we send this back to council with a favorable recommendation.
I second. All in favor, say aye.
Aye.
Aye. There's no one here for opposing. So let the records indicate that it'll move favorably back to council meeting favorably. And thank you to you and your team, Mrs. Chaparro, for moving this initiative forward for this population and getting this extra grant to support the work that we were already doing. I love to see things like that expanding on these networks and these populations that need the most help. So next we'll move on to the next agenda item, which is, excuse me for juggling here, is Mayor Bronin with accompanying resolution to accept a grant of $126,000 from Community Alliance for Research and Engagement at Southern Connecticut State University, introduced by Mayor Bronin. So Ms. Chaparro, the floor is yours.
Great, thank you. So this grant, as you mentioned, is $126,000 for approximately 13 months. So it started, the range is May 1st, 2022 to June 30th, 2023. And it is a partnership from the Alliance for Research and Engagement at SDSU and the Yale School of Public Health. So what this program is doing is recruiting 20 local residents. I know that the resolution, I think, said 10 residents, but it is 20 local residents to build a community-led health initiative. So this is to replicate a program that has been working in the city of New Haven. Basically, residents will take part in a series of workshops about health equity and justice, health disparities, and the social determinants of health, and community level interventions, while building leadership skills to create change in Hartford. The long-term objective of the Health Leaders Program is to build a community of stakeholders that can partner equitably in the existing infrastructure of community health initiatives and public health practice here in our city. So essentially, we'll be recruiting 20 community members who would like to participate. We'll be training them around these health equity issues, or around health equity, and we will be, they will receive a stipend of $2,700, and they will partake, once their training is done, they will then also partake on a community-wide project. So they will determine a project that, based on what they've learned, to then do in the community in Hartford.
Thank you, Mrs. Chaparro. Any questions from my from Councilman Gale?
Sure, thank you. Couple of questions. This grant and the last grant, are these grants that are applied for through your office?
Yes, so the previous grant, yes, I have to give kudos out to our Ryan White team, who really took the lead on applying for that grant. And then this particular grant, I'm not sure how competitive it was. We were basically asked to participate with the CARES program on this particular grant.
And who's the funding source for this grant?
So the funding source for this grant is through a program called CARES, which is a subsidiary of SCSU and Yale School of Public Health. I'm not sure who their funders are. I could definitely look into that for you.
Well, good for you guys. Good for the Ryan White team for getting the last grant.
Yeah.
And I guess anytime you're asked to participate, I suppose can't hurt. If somebody's offering to throw some money our way. I must say I'm not quite understanding the concept though. This training of 20 random people, and it almost sounds like a college seminar where they got a thesis and they're going to maybe you can help me understand, like what's the goal here that's going to help Hartford or help the public in Hartford? What's our benefit ultimately going to be out of this?
I think that ultimately our benefit is that we are providing education and training to individuals so that they're well informed, right? And so when they're out in the community, they're able to speak on public health topics from a point of, well-researched information rather than hearsay or, just kind of like what they're hearing from friends out in the community. So this is a little bit more targeted to, I think, just having small pods of people in the city of Hartford really learning essential health topics and understanding what it means, understanding what terms mean, and understanding what those concepts then, how those concepts translate into our community and to the public health well-being of our community.
Okay. All right. It seems like we are all set. I apologize to the public that for this and to everyone here for the inconvenience for the technical difficulties, but we'll continue on. We are now discussing, Mrs. Chaparro was discussing the resolution regarding Mayor Bronin with a company resolution to accept a grant of $126,000 for the Community Alliance for Research and Engagement at Southern Connecticut State University. There was a conversation between Councilman Gale and asking questions of Mrs. Chaparro. But before we begin, I want to introduce Majority Leader Clark. Thank you for joining us, sir. All right, Councilman Gale or Mrs. Chaparro, I don't know where we left off at. I think we were talking about like the training and the specifics.
Yeah, I was trying to get a sense. We have a program I'm familiar with called Leadership Greater Hartford that recruits people and attempts to turn them into leaders in Hartford. And it sounds as though this program is somewhat similar in that regard, that you're looking to recruit a number of people and turn them into community leaders who know more about public health. And I guess you can confirm my understanding, but also I'm wondering what your pool of people, or where you're choosing people from that are going to get become part of this training.
Okay, so it's not quite like Leadership Greater Hartford. So think of it more as like a natural helpers sort of model where we're recruiting lay people from the community who are trusted resources in their community and providing them information to disseminate. So if we think of it more along the lines of like an extension of the work that community health workers do, more along those lines. So finding individuals within community who are trusted, just trusted folks that people go to for information and giving them, training them and giving them health information, and in particular around health equity.
If do you have any examples of who these people are, or how you're going to, what pools you're looking to choose these folks, if you know?
I'm not sure exactly where the program staff has indicated that they would be recruiting from. but we'll find them. So this is really, we'll find them through some of the programs that we already, work with, such as the REACH program, and partnerships with our community-based organizations through programming that we already do and partnerships that already exist.
Thank you. I have no other questions, Mr. Chair.
Majority Leader, any questions?
Apologize. Thank you, Mr. Chair, to you. And I apologize for joining late. Could you just, Carmen, could you just let me know what the actual program is again?
So it's called CARE, and it's a program that is through Southern Connecticut State University and Yale School of Public Health. And essentially, they've given us $126,000 for about 13 months to provide 20 community members with training and education around health equity and social determinants of health. They'll get training as part of this, and then they'll also have the opportunity to do a community project based on what they're learning and what their understanding of their learning is. And each person will receive a $2,700 stipend. And this is an extension of a program that they've trialed in New Haven and has proven to be very successful there. So they're trying to extend it out into other communities at this point.
Thank you for the explanation. I'm familiar with something similar that the Connecticut Health Foundation had made available to certain community health centers. It was more so from the advocacy standpoint of learning various. It was about 13-month program. There was a stipend at the end. We made a requirement in order to qualify for stipend. You had to attend the majority of the sessions, and you were able to understand about how to become an advocate, how to really do a groundswell of support around an initiative. What are the effects of effective lobbying and things of that nature, and understanding the role of government. So it was. I was one of the presenters, so I'm very familiar with something like this, teaching a few courses. So it was very impactful, I would say, and also too, people learned a lot from it. Unfortunately, it got cut short because of COVID. But I think that that's something that definitely would be able to benefit people in the city. So is this specifically for Hartford residents, correct?
Yes. Yep.
And through the chair, how are you going to identify residents, and is there a qualification process?
So I don't know if there's a qualification process, but the idea is to identify participants through some of our already existing programs, such as our REACH program, and through our community partners that we partner with as well. Okay.
And it says 13-month, $2,700 stipend.
The grant is 13 months, so it started May 2022, but the actual participants will not be recruited until about August. So there's a short time frame for us to do some of that legwork. So we're looking August through June.
And through the chair, where is the program going to take place? At the health department?
I presume that any meetings would likely happen here or through some of our community partners. I'm not really sure, and I'm not sure if the senior project manager has gotten sort of to that granular space yet, as to where meetings will be held and how that will all be conducted. I'm not sure if she's intending to do things remotely initially or whether they'll have in-person meetings. I think that that's all stuff that she and her team are still trying to coordinate and figure out.
Okay, and also too, through the chair, for us, the stipend, is that going to be in the form of a gift card, or has that been discussed yet?
I don't know the answer to that completely. Sadly, because it'll go through my office. I wish I did know. I'm not sure whether in the past, I think they've done them, when they've done something, programs similar to this, they've done checks to the participants. And I'm not, the other thing is I'm not sure if it's like a one-time payment or if it's multiple payments throughout. I would have to ask for clarification on that.
Okay, and my final question through the chair, if a person has transportation issues, is that have been monies appropriated through this grant to do bus passes or schedule Uber or Lyft rides?
I know on the grant that I just presented, I know that they did. I do not have the budget for this particular project right in front of me, so I'm not really sure. I would guess that based on the population that they're trying to recruit for this, that, and thinking around equity, that they will have that in their budget, but I can certainly ask for clarification. And if it's not written in there, make sure that there is. And I'm not sure if they've gotten to that point even and itemizing their budgets, but I will most certainly have a conversation tomorrow with the manager there.
Okay, thank you very much. That concludes my questions, Mr. Chair.
Thank you, Majority Leader. So piggybacking off of Majority Leader, I think Councilman Gill and Majority Leader, I think we're all in the same vein in terms of access and the people to be involved in this training. So just to take it a step further, will they, for folks who have childcare issues and is there an idea of the time of day when this training would take place? Are we considering that in terms of childcare reimbursement for folks to be able to come so that way families and parents of children can be involved, and or the time of day for folks or family who may be working during the daytime and evening would be more convenient for them?
Thank you for that question. That's a really good question. And again, I don't have all of those granular details here. And it could be that they're, in the past, we've also partnered with DFCYR and their early childhood programs to help sort of address some of those issues. I'm not really sure whether they'll have, whether they'll wait to recruit folks and then as a group determine what the best meeting time is. I'm not really sure what process they're using. Leonie's texting me, so let me see if she's
and I know she was. I feel bad. She could just email us after.
Yeah, so that's she just said it's still something that we're working through with the funders. So again, this is something that they've done well in New Haven. So hopefully that we'll be able to mirror that project here, and we'll as soon as we know from the funders how they want us to address that, then we'll certainly let you know.
Thank you, Mrs. Chaparro. So this is just my last question. It's more of a question / suggestion, because I realize you don't have the particularities in the budget, and I know you just kind of slid in here and stuff like that. So it's kind of if you don't have the answer, it's fine. It's just in terms of consideration. So just my back of the envelope math here. It seems to me that the objective of this program is the people and training the people. However, the stipends only account for $54,000 out of the $126,000. That leaves about $72,000. I would imagine that there's probably some administrative overhead, probably some cook, some food and things of that nature. But it's still heavy on the other end. And not sure if you know of that, what that, the majority of this grant is, how that's going to be allocated. And if not, you guys could kind of let us know after if you have just high idea as to how it's going to be broken down. And if you don't, that's fine as well.
So I'm sure that program materials will be a good part of that, along with, I know that they are hiring a consultant as well to work with the individuals through this. So that's where I'm guessing the consultants and then the program supplies and materials will be the largest. We're not taking overhead on this particular grant. It's too small for us to really, do so.
All right. Well, thank you so much. I appreciate it. And if you guys could send that along too, just I think from the council perspective, just, the particular budget, even it doesn't have to get granular, but just general things that are earmarked, we appreciate it. So the chair will entertain a motion.
Motion to send back to council for favorable recommendation.
All
Second.
right. Any concerns or conversations? Seeing none, all in favor say aye.
Aye.
Aye. Let the record reflect this agenda item has been favorably passed and moved on to council with a favorable recommendation.
Okay.
All right. Seeing no other business, thank you, Mr. Chaparro, for pinch hitting for us and answering the questions. We appreciate it. And thank you to my council colleagues and Attorney Osborne for joining us tonight. Enjoy the rest of your evening.
Okay, thank you so much.
Okay, bye.